He was extremely, extremely witty and funny. I mean, mature humor from the time he was like 5 or 6.
And by his sophomore year of high school, his mother says Griffin Hoffman had grown into a teenage tennis star, a young adult with a big heart who was still a kid at heart.
I miss every last thing about him. It's really difficult to talk about when you're talking about your son.
But Carrie Cohen wants the world to know about the anxiety Griffin suffered, like so many teens during the pandemic, experimenting with cannabis, then prescription pills.
I also had many conversations with him, and so did his dad, about the dangers. You know, he knew there are a few things you never ever do.
But it sounds like you wanted him to talk to you about all of this.
Definitely. And we made it very clear, like, you're not going to get in trouble. This is what it matters, is discussion.
Then, on a Monday morning in March, a school day, Griffin's father went to wake him up.
His dad threw open my bedroom door and said, "Carrie, get up. Something's wrong with Griffin." The first thing I saw was his hand, because his dad was holding it, trying to find a pulse, and there was no pulse. And it was just blue.
Did you already have a sense about what might have happened?
I figured in the beginning that he took something. He must have taken something and not known. And right away they found those blue pills.
Pills like these that Carrie would later find out looked like oxycodone, but were counterfeit, made with something 100 times stronger than morphine: fentanyl.
My kid wasn't an addict, you know? He was just doing normal experimentation like any other kid. He was just like a regular teenager. The fact that it happened to my kid is evidence that it could happen to anybody's kid in a lot of ways.
Investigators say they were able to trace back who those very pills came from a street dealer that handed them to Griffin, then up 2 levels, to a 24-year-old alleged drug trafficker they call a merchant of death. A federal indictment naming him as Manuel Antonio Souza Espinoza of Vancouver, caught in late March with this bag of fentanyl pills and a firearm, investigators say, during an operation with a lower-level dealer who cooperated. Espinoza facing 20 years to life, if convicted, court filings read, for selling fentanyl that resulted in the death of a child. The defendant's lawyer did not respond to a request for comment.
We asked the district attorney, who was the last person who knew what these things were and that they could that probably might kill. And they told us every last one.
Really?
Yeah.
Last year alone, we had 11 deaths in the state of Oregon from young people under the age of 18.
And while U.S. Attorney Scott Ospog declined to discuss the specifics of Griffin's case, the explosion in Oregon of the synthetic drug that's easier to transport and cheaper to make means his office is battling an epidemic.
We can't prosecute our way out of these cases. What's important is that kids understand, that young people understand, that what they're taking has the high potential to kill them.
Please make sure that you are not taking these pills. They are designed to look like oxy.
Which is why the principal at Griffin's school, McDaniel High in Northeast Portland, posted a plea a day after the 16-year-old died.
We're going to take the pills from you. We will not be asking any questions.
The grief is going to stay with us for a very long time.
What have you personally learned over the last few months?
It wasn't clear, the level of the danger and how prevalent they are and what our students potentially and what the community is potentially buying. If you're buying anything on the street, it's fentanyl.
And now it's much more clear.
Much more clear.
And that's in part due to a flurry of public health warnings issued to show, color aside, that prescription pills on the left here and counterfeit fentanyl on the right can look nearly identical, with experts pointing out it takes just a few grains, less than the tip of a pencil, to prove fatal.
When we're seeing people OD on half a pill, sometimes potentially even quarter of a pill.
And Lieutenant Chris Lindsay with Portland Police Narcotics and Organized Crime shows us
I mean, this is pretty typical for how it's all shipped up in bulk like this.
the surge has grown so great.
This section of this vault is dedicated exclusively to fentanyl storage.
In their secure drug vault, fentanyl has its own section.
These are counterfeit oxycodone pills.
And they're all marked evidence. They all say suspected fentanyl or fentanyl. There's a lot here. How many pills in here?
Probably hundreds of thousands.
Probably hundreds of thousands.
In 2021, Portland police say they secured over 300,000 confirmed or suspected fentanyl pills. In the first 5 months of this year, they've already brought in 90% of last year's totals, with teens an easy target.
Apps like Facebook, Snapchat, and Telegram are huge. We're seeing it on the dark web as well. This is very preliminary. We're starting to see them come in the form of counterfeit Xanax now. The little white Xanax bars. This stuff is dangerous. This is what it looks like, and it can kill you.
There's no redemption. I mean, the worst thing in the world happened to me. The worst thing in the world. That every parent's biggest fear is what happened.
The reality of her son's death still so raw, Carrie can't bear to look at pictures.
Yeah, I can't.
Instead, this mother finding her memories and comfort in an enduring symbol of his life.
I got a tattoo of a griffin to commemorate him. Yeah, my life pulse, you know. Had the biggest heart. I mean, he cared so much about people. That's what I want. I want people to remember his humor and his heart.
How can I help you? Hi, I'm the administrative secretary at Hudson's Bay High School. I need an ambulance immediately. I've got a student overdosing in the bathroom. Okay. All right. Are you with the patient now, or do you have info for someone with them? I have multiple administrators, DROs, and a nurse with the student at this time. Right. I believe they're administrating Narcan.
On a Tuesday morning in May at Hudson's Bay High School, school officials found a student in a bathroom stall.
The student is 16 years old. 16, male or female? Female. Female. Is she awake? She is unresponsive.
They locked down the school. A district resource officer wrote in a report they found burnt tinfoil and blue pills, likely fentanyl, on the girl's clothes.
You said you believe that they have been able to get some Narcan? Yes, it was rushed up to the location of the student by the nurse.
A school nurse and a medical responder both used Narcan, an opioid reversal medication, to try and save the girl's life. She was rushed to Peace Health Southwest Medical Center, then transferred to Randall Children's Hospital in Portland, where she died 6 days later. I learned about this girl's death this past summer. Through months of public records requests, I was able to confirm she died of a fentanyl overdose that happened here in this high school. Once I knew that, I wrote a letter to the girl's parents. They're heartbroken. I was able to meet with her mom, who asked we not use her daughter's name in this story, and she didn't want to be interviewed. But she said, we should share what happened. She wants people to know, and she wants to help prevent the death of somebody else's child. On the day the student was found in the bathroom stall, Hudson's Bay High School Principal Val Seeley sent an email to families. It said a student experienced a medical emergency at school and was taken to the hospital. She sent the same email to school staff members, but it was prefaced with a bolded message to read this statement verbatim to address rumors. Quote, "Don't go off script and start answering questions." A week later, Seeley told families, students, and staff that the girl died after her medical emergency. She offered grief counseling and support. The school and school district never publicly said she died of fentanyl poisoning or that they found fentanyl at school. Vancouver Public Schools Superintendent Dr. Jeff Snell says they're not required to share this information. When there's a fentanyl overdose at school, wouldn't parents want to know?
Well, I don't know what parents would want exactly. I know in situations that, I think what you're getting at is if there's an overdose, do we just say a student overdosed from fentanyl at the school? I think that we as a school have a responsibility to be thoughtful about that and engage the family of the of the person that did that in terms of what's disclosed.
You would then leave it up to the families to decide whether you'd share, hey, there was a student who overdosed on fentanyl at school.
And trying to balance, like you're saying, you know, the desire of an entire community to understand what's happening versus the desire of a family that's went through something, you know, horrible.
But for other dangers, like a student bringing a gun to school, that information is often shared with families without the student's name. Why wouldn't it be the same with something as deadly as fentanyl?
If we want to put our head in the sand, we're just going to keep seeing more overdoses and more losses at every age level. So we have to talk about it.
Marsha Malsom's nephew, Race Rudine, died of a fentanyl overdose in Seattle in 2016. She now leads a foundation that works on fentanyl awareness throughout Washington state, talking with schools, working with the DEA, and with lawmakers.
We have a problem in our country. And it shouldn't be an embarrassment because it's in your school, but how are we going to fight it in our school? And how are we going to avoid a horrific story instead of reacting?
The Vancouver student's mom told me she would have been okay with the school district sharing that a student died of fentanyl, even if people could draw conclusions between the death of her daughter and the announcement, because the community should know about the danger. Federal agents with the DEA who investigate fentanyl cases agree. They see how these pills are in every community and say it can be dangerous to think, it's not in my school.
From the DEA's perspective, why should families and the public know about a case like this?
The transparency and the communication, it is the most important thing because we need to save lives. And the way to do that is to get the word out of how dangerous this is.
About a month after her daughter died, the Hudson's Bay High School student's mom called Vancouver police, asking them to investigate how her daughter got fentanyl. She explained that her daughter had been a straight-A student. She was on the volleyball team, but she got caught up with the wrong people. She told police that doctors said her daughter died of a fentanyl overdose. And she gave this to police, screenshots from Venmo, with her daughter paying a man and captioning the payment with a blue circle emoji with the letter M, paid about 2 weeks before her death. Fentanyl pills, commonly called blues on the street, often come with M's marked on them to look like oxycodone tablets. The police reports show that a Vancouver police detective talked with the girl's friends and family over the following months, but he couldn't make an arrest for one big reason. Police didn't have the blue pills as evidence. Police were never called to the emergency in the high school bathroom and didn't start an investigation until a month later when the girl's mother called them. Officers were never able to develop probable cause to arrest anyone involved with supplying the fentanyl that ended up killing the student.
In that case, police were not called to investigate or file any sort of criminal report. Do you know why?
I don't know specifics about the case. I think you would have to, ask other people or look at the situation.
In any case, the delay in calling police made holding anyone accountable for the drugs difficult.
What leads to a successful prosecution in a fentanyl case? What are you looking for?
With any investigation, sort of time is always of the essence. So the sooner that investigation can start, the better it's usually going to be, for a positive outcome.
Since May, Vancouver Public Schools has overhauled how the district prepares for a fentanyl overdose. District resource officers, along with nurses, now carry or have access to naloxone, an opioid reversal medication. A common brand is Narcan. It's now available at all schools, not just high schools. And nurses have a new system of logging and tracking when Narcan is used, when it needs to be replaced, and where it's available.
It seems to be a growing concern, right? And so if there's growing concerns, we want to make sure that we're expanding the services that we have to potentially address those.
Nationally, teenage overdose deaths from fentanyl more than tripled between 2019 and 2021, far outpacing every other type of drug. Washington is one of several states that requires many schools to have opioid reversal medication on hand.
Part of our foundation's work is we do naloxone training or Narcan training. And I've had from parents to administrative staff say, we don't have drugs in our school. And that's not facing reality. It's there. It's in every school, unfortunately. It's what each school does to handle that will make the difference.
But that state requirement is limited. Only school districts with more than 2,000 students are required to stock naloxone. It's only required for high schools. There's no set funding for schools to get the medication, so they often rely on donations. And crucially, Washington State Education Agency doesn't track when school officials use naloxone, so there's no way of knowing how many kids may be overdosing or how prevalent fentanyl is.
We know metrics really help us have better education, better research on how to be more proactive, how to educate the community better, and it's a shame we aren't tracking it in a very confidential way, just to the numbers.
That means school districts are often navigating on their own, deciding how or even if they should share when they find fentanyl in school. Snell says his district is trying to be proactive, sending out messages to families about the threat of fentanyl and what to look out for.
You talk about the education and informing about the dangers being very crucial. Wouldn't the most poignant time be that when something has happened to come out directly and say, hey, this happened here?
Certainly in some situations it could be. Yeah.
Malsum says that's not enough. People should always know, and families should be talking about this.
The highest danger is it will happen again. If people don't know this is happening, how's it going to stop?
This week on Straight Talk.
And it's everywhere. It's everybody we contact.
Be very cautious, be very careful.
Battling the fentanyl epidemic.
It wasn't clear, the level of the danger and how prevalent they are.
Because a few grains can have fatal consequences.
He was just doing normal experimentation like any other kid. He was just like a regular teenager.
Last year, the synthetic opioid up to 100 times more powerful than morphine.
We're seeing people OD on half a pill.
Killed a dozen kids in Oregon.
Right away, they found those blue pills.
This year, it's changing shapes.
The little white Xanax bars.
And colors.
It could look like sidewalk chalk. It could look like a pixie stick.
Cheaper to produce.
They sell for as little as $3 a pill.
And easier to transport.
I mean, this is pretty typical for how it's all shipped up.
This guy's not going to stop.
With record seizures.
How many pills in here?
Probably hundreds of thousands.
Probably hundreds of thousands.
New public warnings.
What they're taking has the high potential to kill them.
And our teenagers.
We're going to take the pills from you. We will not be asking any questions.
Including 16-year-old Griffin Hoffman, who was poisoned in March by a counterfeit prescription pill.
He must have taken something and not known.
An easy target.
The fact that it happened to my kid is evidence that it could happen to anybody's kid.
Welcome to a special edition of Straight Talk. I'm David Molko in for Laurel Porter. Over the next half hour, we'll be having a conversation we hope you will share with your family, your friends, and your loved ones about the explosive growth of fentanyl in our region, the evolving risks, and as you just saw, very real consequences, especially for young people. So let's welcome our guests here. Carrie Cohen is Griffin Hoffman's mother. Griffin, the tennis star and sophomore at Northeast Portland's McDaniel High, who died earlier this year. Dr. Anna Hildy is a child and adolescent psychiatrist who specializes in working with youth struggling with addiction and mental wellness. She is also the medical director for Haven Counseling Collective. Next to Dr. Hildy, Scott Caron, an assistant U.S. attorney for the District of Oregon. He is currently prosecuting some of the highest profile drug cases involving fentanyl in our region, including, we should point out, the alleged drug trafficker charged in connection with Griffin Hoffman's death. And on the end, Cam Strom, currently with the Oregon-Idaho High-Intensity Drug Trafficking Area Program. He recently retired after 3 decades at the Drug Enforcement Agency, most recently as Assistant Special Agent in charge for the DEA in Oregon. I should add here as well that you are all parents as well. So Cam, Scott, Anna, Carrie, welcome to Straight Talk. Cam, one of the challenges here is we talk about the blue counterfeit M30 pills, like the ones Griffin took or the one Griffin took, but it keeps changing form. I mean, every week it seems like we've got a new release or warning from the county or the U.S. Attorney's Office, the DEA's office, saying, watch out for these rainbow-colored pills. We're calling them Skittles. Or watch out for this powder that looks like sidewalk chalk or a pixie stick that a kid might think is candy. I mean, what have you seen? What is your guidance for parents here that are just trying to keep up with this?
The guidance is the same. You've got to talk to your kids. You've got to educate. You've got to really share that if it doesn't come from your doctor, if it doesn't come from a pharmacist, you've got to assume it's got fentanyl in it. It's unfortunate to say, but 4 out of 10 pills have a lethal dose, and we're seeing fentanyl in all shapes and sizes and all different kinds of pill configurations. You have to make that assumption.
I just want to kind of get a better sense, because Carrie touched on it here with social media, and Cam, feel free to chime in as well, how it is getting into young hands, the sort of distribution when we talk about teenagers getting, their hands on counterfeit pills that turn out to be deadly.
Sure. What we're seeing a lot is it's off of social media. I mean, any kid that has a Snapchat account also has a drug dealer on the end of that line. It doesn't mean that they're there. Snapchat has lots of very valid reasons or valid purposes. But through social media, whether it's Snapchat, whether it's Facebook Messenger, any of these other apps that are out there, drug dealers are both looking for victims out there. They're looking for people to sell to. They're seeking them out. And kids are also going online, whether it's to experiment or not. They can reach these people on social media, and those dealers will deliver it to them. So it's making it very, very easy.
What kind of conversations are happening on those apps in terms of what kids are asking for, or what's happening for parents, to kind of look out for, if that's even possible here?
See, a lot of it is, it's looking for blues. Blues is the phrase that we hear all the time. And as Dr. Hildy mentioned, it's not just the fake M30s that are out there, but I've seen fake Xanax that are out there, fake Vicodin that are out there, fake Percocets that are out there. It's just these blue M30 counterfeit oxycodone pills are what we're seeing a lot of. That's just flooded the market. And so it can simply be a matter of, hey, I've got some blues, or I've got some buttons. Anyone want some? And people are like, sure, I'll try it. And they will deliver them to them. And sometimes, at the level that it's getting to our kids, it's getting to them in small amounts, 1, 2, 3, 5, 10 pills. It's very, very small amounts. And these dealers will deliver that.
Carrie, one of the things you and I have talked about too is nothing can bring Griffin back. Mm-hmm. But, we've got, I know you want justice. Now you've filed a lawsuit too against the alleged drug trafficker who's charged with your son's death. What else though? What might help at this point?
For me,
yeah,
nothing can help. I think time and, but I don't think anything's ever going to help.
Yeah. Well, you know what? We're really glad you're here with us today. Let me just say that.
Thank you.
I want to ask you, and I did check with you earlier to make sure that you were okay answering this question, because I'm very mindful of, kind of triggering and kind of having open dialogue here. If Griffin were here with us today, what do you think he would say?
He would say, how much longer is this going on? Can I please go home? That's what he would say.
Or go practice tennis, right?
Right, exactly. Or hang out with his friends. What I know for sure about my son is that he was very, very caring about other people. He cared about social justice. He stood up for his friends all the time. He was, some of his friends lost the person who they turned to with their own sort of mental health struggles. So, and this is another part of why I do this, why I keep talking about it, is because he would want that. He would do that too.